I wouldn't say that about somebody who was genuinely a good person. Like, I might not have agreed with them, but unless they were a serial killer,
I'm just saying
sick.
that a lot of stuff the media condemns Trump for is the same stuff that we do as everyday citizens.
Well, I'm not saying that people don't say
He
that.
just
That's
does it
not,
on the platform.
It's not the fact that he said it. It's purely because he just doesn't like him. McCain never did anything to him, personally. He just doesn't like him. Never
Okay.
did.
So, when you say that he didn't replace Obamacare,
There is no
whole thing to replace
Yeah.
Obamacare, right?
Like, he has signed these executive orders saying, I'm going to do this, but okay, well, it's not been implemented. Like, there's nothing there that people can sign up for
The
to
right
replace.
to try.
But I'm talking about insurance policies that people can sign up for. Because if you take away Obamacare, a lot of people are not going to be without insurance that otherwise would not be able to get it if they re-sign up because they have a pre-existing condition.
Well, I know people that's actually got insurance.
And it's not perfect. It's a lot of people can't afford it.
But
No, it's very
Obama had plans where it was mandatory.
And they
that
did
you
away
had
with
to.
that.
Well, that's a good thing.
That's what I'm saying, but
To
they've
do
done away
away
with that. But the plan was...
Ain't that what Trump? Ain't that some of the things that Trump's doing? Doing away with where it's mandatory for you to have insurance.
I feel like people should have to have insurance.
Do you feel like people should have to have insurance?
Yeah, because I feel like I don't feel like... I feel like it's a human right to
You
have
feel like people
insurance.
have to have insurance?
I feel like they should. I mean, what I'm saying is, I don't feel like it's that big of a deal to enforce insurance because in the long run, I feel like it balances out the payout.
I go to the doctor and get sick 0 times in a year.
Yeah, but what if you were in a car wreck?
Okay? Then
And you have 0 insurance. This
Then you
hospital
settle
won't
with
see
the-
you. That specialist won't see you. You have
They will
hundreds of
see
thousands
you.
of dollars, and the emergency room will see you.
but they
a
do
lot of
see you.
specialists will not see you. Like physical therapy, you have to pay out of pocket,
Okay.
and people
But-
can't afford that.
You
Especially young people,
do
the
get
people
sick.
that are
And then
the ones that don't want it.
Then you also you settle with the insurance companies for, hey, you say, hey, this is what it's going to cost. This is what I'm going to pay. You make them cut a deal with you.
Yeah, well, either way, I
But
feel
they
like
shouldn't have
Obamacare
to
wasn't, when it was
insurance.
implemented, it wasn't like, okay, this is it, we're done. It was something,
Well,
a
it should
foundation that you
it should have never
work on.
been implemented to begin with that fast. It crashed. They didn't even have you could call Google, or you should have got Mark Zuckerberg or people in Google to actually make them a website that worked. We're America.
I'm not even
and
talking
we
about
couldn't
signing
even
up and all that stuff. I'm
sign
just
up
talking about the
and
foundation of having affordable care, which
yes,
is
I
so
agree.
affordable for everybody.
I
But
agree.
it was something there that you work on. Like, this is your foundation, and then work with it. Like, tweak this, change that, try, implement
I know people
that.
that's got insurance.
And if you're going to take it all away, okay, but have something to stick back in that hole that you
that's
just
what I was
created.
trying to say. I
And
know
there
people that's
is-
got insurance like Blue Cross Blue Shield. They pay so much a month. They get so
Mhm.
much coverage. And this is since Trump's been in office, and they like their insurance that they're getting through that.
And a lot of people do. A lot of people can't. I mean, you get the subsidies, it's more affordable, but a lot of people can't afford it, which is the problem. But that's the whole insurance companies, that's a whole nother,
I mean, how much?
a whole nother issue.
I mean,
but-
you're looking at $600 a month. for insurance. They can't afford that.
A lot of people can't.
I had to pay almost $600 in insurance, and I actually got good insurance.
Yeah, for family insurance, that's good. That's cheap.
What?
$600 a month for family coverage.
I know people
Not
that's
bad.
got Blue Cross Blue Shield insurance that pays, I think it was, I think it was like $700 a month. And it was so much, it covered so much throughout the year. And that was their insurance.
And that's fine. There's nothing wrong with that. If you like your insurance, keep your insurance.
No, I'm just saying that they paid out of pocket without a company. They got packages that you can go buy insurance with, like through the care that, like, why can't people go buy that insurance that's $600 a month?
I don't understand what you're saying. People can buy what insurance they want as long as they don't have. I mean, previously a lot of people couldn't because they wouldn't cover you if you had pre-existing conditions, or if you had pre-existing conditions, it was not affordable. They skyrocketed that premium.
Okay, so what's so wrong when you said there was nothing there? They replaced Obamacare and there was nothing there, but people went to Blue Cross Blue Shield by themselves, no group plan, and got actual insurance for almost the same. I mean, don't cover what my insurance covers, but it covers enough
Plus,
to
it
get
doesn't
through.
matter. You don't have to use Obamacare was put into place to allow more people access who previously couldn't afford it. That's what it was there for.
Okay, this is basically Obamacare, the Blue Cross Blue Shield's package of Obamacare.
Okay? You don't have to go through healthcare.gov though, do you? To get insurance?
No. But you're missing what I'm
I was
saying.
gonna say, I do not
You're
understand
saying
at all
that
what
he
you're saying.
replaced.
He didn't replace anything.
You're saying he didn't replace nothing
No,
of
he
Obamacare.
created something. Oh, you're talking about Trump?
No, yeah, you're saying that he did away with Obamacare.
No, he didn't. He wants to.
That he's
trying to overturn it and get it taken away, but then that takes away insurance for like 20 million people.
But there's still people that can go out and get insurance.
But they can't afford it now. That's the problem. That's why they were on Obamacare.
Okay,
And Obamacare is what insured these people that they are pre-existing
Who are these
conditions. People who were on Obamacare. Before Obamacare existed, pre-existing conditions, they could say, sorry, not gonna cover you, just because. When that was enacted, they said, oh, you can't do that anymore, you have to cover these people.
Okay, you said Trump is doing away with Obamacare.
He
It's
wants
not
to, that's his whole plan.
replacing it.
He
But I thought
doesn't
you said
have-
he did.
No, he's trying to. He's in the Supreme Court, I think. It went to the Supreme Court and they said, no, you gotta do something else. They bumped it back down, so it's gonna work its way back up again. They had to do something. I forgot what it was.
Okay,
He had to do
but
something.
you got programs like Medicaid, Medicare.
Well, yeah, but Medicaid, you have to
Why
be
do we need
so
another-
extremely poor. You have to be really low income to be Medicaid, unless you have children, like young children. Your children can be on it with a family. It's easier to get a child on Medicaid than it is an adult.
But I'll tell you this, I got one of the few times I did get sick. I went up here to the Doc in the Box, or the urgent care, and there was a 20-year-old kid that got 13, 14 doctor visits free. Or no, it was like, what did I say, $2? $1 for a doctor visit? And he got to see the doctor 13, 14 times throughout the year on Medicaid, 20 years old. Why is that 20-year-old?
He was probably on
Oh.
SSI of some sort,
SSI.
disability. You have Medicaid. That's
He
a way for
was
people
not disabled.
to. You don't have to be physically disabled. You could have other stuff. You could have.
I don't think he was mentally disabled
You
either.
don't have to be mentally disabled. There's different things that qualify you, like
Okay, physically disabled,
like
mental
handicapped, physically
disabled.
and handicapped. I'm not talking about necessarily handicapped. I'm talking about medical conditions that will qualify you. There are a lot of them.
ADHD can qualify some people.
Yeah, like I'm saying, you're not disabled with ADHD, but a lot of kids will get on it, SSI for that, which makes no sense to me.
So
But if you have like
Where-
a pituitary problem and you have to take steroid injections or pills and all that every day so that your blood pressure doesn't drop out and die, like that's something that will be covered for SSI, and you will live a perfectly normal life, but you can stay on that insurance because you have that condition. Trust me, I work in an endocrine clinic. I know these things. I see a lot of people
So
who
you
are
got
on SSI.
you got a lot of people that are on SSI. So you admit there's a lot of people. What's SSI? Is Medicaid, Medicare,
It's Medicaid.
Medicaid. So you're telling me that there's a lot of people on Medicaid that shouldn't be.
No, I mean they're covered. I mean it's just they're covered because they're protected by the Disability Act. They're not technically disabled, but they're protected by the Disability Act.
So I'm just saying there's no need for Obamacare when you've got other Medicaid, Medicare.
But you have to meet certain qualifications to be on those two things on the different end. You've got to be 65 or on dialysis to be Medicaid. I mean Medicare. There might be others.
Well, that 21-year-old was it. And then I know
He was
another
on
person
Medicaid.
that
I'm
was
talking about.
30-something years old or he was a little bit older than I am, that had insurance through Medicaid, Medicare, and there was nothing wrong with him.
Well, there was something going on unless they had somebody working the system within the Medicaid office because it's really hard to stay on SSI and it's really, really hard to get on Medicare before you're 65 years old.
Medicaid, Medicare is...
Medicare is for old people, Medicaid is for poor people.
Okay.
That's
Well, we
that's
got
an easy way to
Medicaid.
remember it.
We got Medicaid, so why is there another need for...
Because there are people that fall in between that gap, people that are not meeting the poverty guidelines but also aren't 65 years old that can't afford insurance, or insurance companies turn them away because they have some sort of condition that they don't want to pay for.
Well, Trump said last night that he's doing away with, trying to do away with pre-existing injuries and conditions. Did he not?
I didn't hear him say anything about that last night, so I'm not sure. But you have to have something there, because if you repeal Obamacare, a lot of people lose access, period.
I know. What about the peoples that...
I say, if you're going to repeal it, replace it.
What about the people that
And that's what he says he's going
insurance
to do, but
went
we've
up
not seen anything.
on them after Obamacare?
That's what I'm saying. It's not a perfect system. It's the insurance companies. You can't, there's...
With Obamacare, that's the insurance company. Obamacare.
No, the
Government.
insurance companies are still Blue Cross, and
And they're doing the Obamacare.
they have their plans that's through the Obamacare. It's like their you get like these specific plans, and you can get subsidies to help you